Come in.
Alrighty. Hello.
How you doing?
My name is Natasha. I'm a student nurse practitioner, and I'll be doing your abdominal examination
Oh,
today.
hi, my name is DeAndre. Nice to meet you.
Nice to meet you too. Alrighty. So, do I have your consent to record this for my professor?
Yes.
Yes. Alrighty. Can you go ahead and lay back for me?
Okay.
Alrighty. Okay. So I'm making sure you're in the proper position, which is supine. I'm gonna go ahead and lift your shirt.
Okay.
Alrighty. And make sure your abdominal muscles are relaxed. Are you relaxed?
Mm-hmm.
Yes. Okay. Alrighty. So first, I'm just gonna go ahead and inspect your abdomen. Okay. So I'm looking for any pericystosis. I'm looking for normal breathing. Any scars, any wounds. Looking for any type of discoloration. No jaundice is present. Alrighty. Awesome. Okay. So next, I'm gonna go ahead and listen. I'm going to go ahead and auscultate all 4 quadrants, and I'm listening for normal bowel sounds. Alright, next I'm going to go ahead and listen to your aorta. And I'm going to listen with both the bell and the diaphragm. Next, your aorta branches off into your renal and iliac arteries. So I'm going to listen to your renal artery with both the bell and the diaphragm. And lastly, I'm going to listen to your femoral arteries with both the bell and the diaphragm, and I'm listening for any brewing, any abnormal brewing or friction rub. So next I'm going to go ahead and percuss. I'm just going to slightly tap on your abdomen. Alright, I'm going to percuss in all 4 quadrants, right upper, left upper, right lower, and left lower. Next, I'm going to go ahead. I'm checking for to make sure everything is tympanic and no dullness. If there is any dullness noted, then that would be a sign of any type of fluids that are present or a full bladder. So next, I'm going to go ahead and percuss your liver. So I will locate the liver. Start on the belly button, then I will percuss upwards until I hear dullness. Then I'm going to go to the mid-clavicular point and percuss until I also hear dullness. Alrighty. Then I will go ahead and measure the liver. And it should be at least 2 to 7 centimeters. Alrighty. So next we're going to go ahead and percuss the spleen. So the spleen is kind of hard to locate, to percuss because it's underneath the ribs. So I will locate it. It should be anterior and axillary. Go ahead and percuss. Alrighty, so the spleen should be tympanic. Any dullness will be a sign of an enlarged liver. Alrighty. So next, I'm going to go ahead and palpate. So you're going to feel me lightly tapping on your stomach. Okay? Or pressing on your stomach. Alrighty. So next, I'm going to deeply palpate your stomach. It's going to be a little bit more firmer this time, okay? Alrighty. Deep. Alrighty. Next, I'm just going to palpate your liver. Up in here. Going to feel me pressing firmly. Can you go ahead and take a deep breath? Sorry, and breathe in. Alrighty. And I'm going to go ahead and palpate your spleen. All right, can you breathe in for me? All right, any pain?
No.
Okay, awesome. All righty. Okay, so next I'm gonna go ahead and check for Murphy's sign. This will be a sign to test and see if you have any type of gallbladder inflammation. So with Murphy's sign, I'm gonna go 2 to 3 centimeters below the clavicular point here, and I'm gonna firmly press. There we go. Do you feel any pain?
Mm-hmm.
No, okay. A positive Murphy sign will be if you felt any pain, and that would indicate inflammation of the gallbladder. Next, I'm going to go ahead and test to see if you have any type of inflammation of the appendix. So, I'm going to locate the appendix, which will be McBurney's point. So I'll go here at the belly button, and the ASIS point will be like 1/3 of the way. So it will be right here. We're going to go ahead and press firmly. Do you feel any pain? No. Okay. So McBurney's point would be positive if there was any pain when I actually lifted off of his belly, which would be known as rebound tenderness. Alrighty. Can you go ahead and sit up for me? Alrighty. Also, there was no ascites fluid on his abdomen. Alright, can you go ahead and turn around for me? Okay, I'm just going to lift your shirt. Next, we're going to check for CVA tenderness. So I will locate the 12th rib in the spine, which will be in the space here. Alrighty. I'm going to go ahead and you're going to feel me pounding lightly on your back, okay? Mm-hmm. Here we go. Any pain?
No.
Any pain?
No.
Alrighty. So a positive CVA tenderness will indicate any type of renal inflammation. Alrighty. Well, we are all done here. Thank you so much for your cooperation.
You're welcome.